Hi, Smart News. How many children between the ages of 12 and 15 received the COVID-19 vaccine over the last week? You know, the one that received emergency use authorization? How many do you think? The CDC reported today 600,000 Americans between the ages of 12 and 15 received that vaccine. And why does that matter for everyone? Well, there are some that believe we need to vaccinate children to reach a level of community immunity or herd immunity. You've heard of that before. Dr. Fauci said again today that with ongoing studies of younger children, we should have enough information by the end of this calendar year or early next to vaccinate potentially children of all ages. Now, the CDC says today that it is very rare. They've said this before. It's very rare for children statistically to have a severe case of COVID-19, which leads to a question for parents who are trying to weigh how do they make the right decision for their families. It's also raised some questions for those who wonder whether or not emergency use authorization is really appropriate for a COVID-19 vaccine for kids, because children are not in the eye of the storm. They're not at the middle of this health emergency, which is how you use emergency use authorization. That said, a White House advisor shared something today during a press briefing that we haven't heard before, and I thought it would be worth your time. Take a listen.
I want to reveal something personal with permission that underscores their importance. Last fall, one of my sons contracted COVID-19. Unfortunately, he is one of the many Americans battling long-term symptoms. He's young and fit and in the prime of his life. But 6 months later, he still suffers from tachycardia, shortness of breath, and ongoing and frequent flu-like symptoms. His hands are cold to the touch. Neither he nor his parents, my wife and I, are sure how long this will last.
So that's just something to consider. We often group COVID cases into the most severe and the recovered, but there is a lot of nuance. There's a lot of room in the middle, and we have to remember that, at least bring it into the story. It's the patchwork of personal experience with science and research that's creating the health policies that we're witnessing as a nation. Just something to keep in mind. A headline from the press briefing today: we're at the lowest case numbers for COVID-19 since June of last year. Meanwhile, many of you have questions about what's going on with the New York Yankees and that cluster of COVID-19 cases amongst those who have already received the COVID-19 vaccine. These are called breakthrough cases. I was reviewing some of my exchanges with the CDC because I reached out to them in the past with some questions about breakthrough cases, and I was reminded that the CDC does have a dedicated team looking into breakthrough cases, and they're getting very specific. Are these breakthrough cases happening in a certain region, amongst a certain age group? Are they happening with a certain vaccine or the way the vaccine was stored? So they are looking at this. The CDC director today answered some questions about how the CDC was looking at breakthrough cases and why they aren't tracking asymptomatic breakthrough cases as closely as others. And I thought you'd like to hear what she had to say.
We were studying all breakthrough infections. A large portion of them were fully asymptomatic. And in fact, when we went to study them and even sequence them, there was inadequate virus to even do so.
Just a reminder, when we're testing for COVID-19 right now, most of the time we're just testing for the presence of the virus in your body. So we can't tell someone you're really, really infected and you're just like sort of infected. That's why we can lump asymptomatic people and those severely ill in one category and those that test negative in another category. One of the New York Yankees, a player, previously tested positive for COVID-19 a while ago. He also received the COVID-19 vaccine, and now he's one of that group that have tested positive again for COVID-19. He's 24 years old. So that's an interesting scenario, isn't it? And it raises the questions for me whether or not the current testing still fits this stage of the pandemic. So that's going to be a question that I'm going to be asking. What do we really know about viral load and contagiousness? And what more can we learn about that and how it affects the community and the individual? Listen, I know I've talked a lot about vaccines, but this was the crux of the CDC media briefing today. I wanted you to get the latest information, but I'm also going to return to some of our research on antivirals. How do we treat COVID? That needs to be part of the conversation as well as talking about the vaccines. So I'm on it, I promise. Questions and comments, let me know. And as always, more on all of this on smarternews.com.